someone is fair, okay, that doesn't mean the person is good looking. Okay, if someone is dark, that doesn't mean that person is not good looking. Okay, so this is all these are all like perspectives and standards made by human beings.
Right.
Okay, and then very common PCOS. Okay,
Yes.
when a patient comes major, like every third woman has a problem. When they come, we can tell they have. Okay, they have a lot of facial hair, a lot of acne, hair fall problem, all these. And you can tell the patient doesn't know that these are the symptoms your body is giving you that something is wrong in your ovaries or PCOD. First 3 months are difficult for patients who are using minoxidil.
When you say difficult, in what ways?
Hair fall happens. So these are hair which are already supposed to fall. I told you about hair cycle, right?
Yes.
There is shedding phase. Okay.
Yes.
So these are hair which are already there. You are supposed to fall. So it takes 3 months for the hair to fall. These hairs are dead. There are like cases where finasteride has caused people when they have used for a long period, it has caused some libido problems, erection problems. So yeah. So everything that you take, there are so many hair growth products. You should know. You should talk to the doctor and take it under the guidance of doctor.
Now, if I open my Insta page, for example, I get 3 or 4 ads says, why do you celebrities have such glowing skin? Because they use glutathione.
Glutathione, how it came into skincare thing is, so glutathione was given to patients with liver problems. Okay. You mentioned onion, you mentioned aloe vera, you mentioned oiling. No, it doesn't. Okay. So you want to massage oil on your head, you want to massage onion, you can do it as much as you want. It will give you wherever you don't have hair. I'm talking about
Dr. Silviya, welcome to the Midnight Lab podcast. How are you and how's life treating you?
good. I'm good. How are you?
I'm doing well. Thank you so much. So, the podcast that we're doing today is around skincare, and this is something that I was looking forward to for a very long time. Now, we are in a society where we are judged by our looks, no matter how many people deny it. That's the fact. The very common phrase from the looks of it basically says that your first impression gets created on the basis of how you look. At least that's my opinion. Right? But do you think that has created a perception within people and has added to a lot of social pressure?
Yeah, definitely. Like, especially the social media. You know, when we open our phone, also the first thing we see is images of people and celebrities. You know, flawless skin, but we fail to understand the fact that those pictures are edited, filtered. So many things are like happening behind that we are not seeing. Okay, so that definitely there are like standards built by social media, and people tend to, you know, they're compelled to meet those standards, and to meet those standards they use multiple products without any, you know, consultation or proper guidance, and which leads to more skin issues.
More like a home medication.
Yeah, home medication, and then leads to more. And then there are like quick fixes in social media. Like if you have a problem, they have like fast fixes to that. So but they fail to understand that skincare is all about consistency. Okay, and then because of it, there are stress which leads to more damage to their skin. So yeah, like social media definitely plays a major role in this pressure of looking good and you know, false standards of beauty.
So, looks, we spoke of looks, right? Do you think there's a other side to it as well that's also increased the skincare awareness among people?
Yeah, like environmental changes, you know, that's one of the there's one of the factors. You know, there's change in pollution, too much pollution nowadays, and you know, sun exposure, and then there is lifestyle changes, you know, the different diets, okay, and then sleep pattern, you know, sleep quality has stress had increased. So and then there is, of course, social media again. So these are the factors which, you know, increased the skin issues and also increased awareness among people. Okay, it's a good thing that it has increased awareness, but at the same time, there's negative points also. Like, you know, people tend to use whatever they're seeing.
And I compare myself to the person on the video and build that perception that I'm maybe not looking or I have some issues.
So they people tend to use whatever other person is using.
Right.
Okay, whatever the person in social media telling, yeah, I use this and this has worked for me, and we think like this will work definitely for me also.
Right.
And without proper guidance, they are just trying to use multiple products at once. And yeah, so these are the factors which contribute into all of these skin issues increase.
Right. I think pretty much whatever topics we want to talk today, you just give a quick summary of that.
Yeah.
So let's deep dive into this. Now, let's first understand cosmetically or in medical terms, what's the definition of a good looking person or a good looking woman?
I think beauty is in the eyes of the beholder, what we say. So it's like,
Very nicely said,
yeah.
right? Yes.
So there is no proper definition of good looking. Okay?
Okay.
Every person has different bone structure, facial structures, and if we are comparing ourselves to the celebrities,
Right.
okay, there is a lot of things they do. Their diet is, they have strict diets and everything. Okay, they don't just go somewhere and like have whatever they want. And also their jaw structure is there, their facial structure is completely different. So for me, if one person is good looking, for you it won't be. So
it's basically in the
completely
perception.
Yeah. So that is, so if someone is fair, okay, that doesn't mean the person is good looking. Okay, if someone is dark, that doesn't mean that person is not good looking. Okay, so this is all, these are all like perspectives and standards made by human beings.
Right.
Okay. So
But
yeah.
we're human beings, and probably since you mentioned about complexion, right? One thing that came to my mind, I have some friends, okay, who some time ago were looking for alliances to get married, and the first criteria for them to probably select or not select a person was complexion.
Yeah.
Unfortunately, we are in that phase, or we live in that era where we are judged by the complexion, no matter
Definitely.
how many people want to deny it.
Yeah.
Right, I'm not saying it is the right thing. It's unfortunately the wrong thing to
Yeah.
do, but that's the sad
That's
reality.
Yeah, that's the reality. Yeah. So that's why people are running behind, to look fair. Their complexion has to be bright. That's why treatments like glutathione, every day you see it's there in the social media, IV glutathione, to make
Very
your
true.
skin brighter, a shade lighter. So that's why. So in my clinic also, every other patient will say, doctor, I want IV glutathione. I'll ask like, why you want? Like, I want to look brighter.
So they
I
look
want
at
to
these videos and they come
yeah,
and tell you,
yeah,
okay.
I want to look lighter. And they don't understand the fact that this glutathione, it's not a permanent solution. So you take a number of sessions, and after you're gonna go back to your whatever shade you wear, whatever genetically you're born with. That
Okay.
complexion is you cannot change that.
Okay.
So all of this has made people to just go and take treatments which they don't even need to just fit in the society. They are doing all of these.
Right. So I think we've gotten to a great start. So you spoke of lifestyle, diet. We'll get to diet part a little later. Let's understand lifestyle and how it impacts your skin.
Okay, so talking about lifestyle,
And sorry, by lifestyle, can you just call out what exactly we mean by lifestyle? Whether it is our sleep, whether it is basically the stress that we take.
So, so lifestyle includes stress, sleep pattern, dietary habits, okay, and the other habits like alcohol, smoking, whatever. Everything is involved, included into lifestyle. Okay, so how skin is getting affected is like, of course, if you have a lot of stress, okay, it's
Okay.
all about hormones here.
Okay.
Hormonal imbalance, everything. Okay, when the stress is increased, there is increase in your cortisol levels. Okay,
The
Yeah.
hormone that creates or
Yeah.
gives that feeling of stress.
Yeah. So there's an increase in that hormone, and
Right.
which causes increase in inflammation, increase in the sebum production. Okay, and which causes acne. And there is like a lot of changes happening in your skin. And then there is sleep. When you don't have proper sleep, okay, you don't have enough, your body is not getting enough time to have a regeneration process. Okay, and then there is and then the next part is the food you're eating, like food like milk, excessive
Dairy
sugar, sugar and everything is involved. Okay, it's not like it's doing any good to your body as well. Okay, so the end part is whatever is doing good to your body is good for your skin. Okay, all right, whatever you're putting inside your body, definitely it's good for your skin and hair.
So you mentioned about dairy products,
Yeah.
right? Now, we always had dairy products, right? Maybe there's a lot of debatable topics these days around whether you have to consume dairy or not.
Yeah.
But one thing that comes up whenever you search online is dairy products. Basically, if you consume it in good moderation, definitely you can manage a lot of things. But how does it affect the skin?
So it's not like everybody will have a problem with dairy. Okay. So if I have a problem, doesn't mean like the other person will also. So it is scientifically proven that dairy products and sugar definitely worsen your acne. All right. So
If you have a acne prone skin.
yeah, acne prone skin. Okay, we are not generalizing it. We are talking about acne prone skin, like how dairy affects them. So because of milk, there is increase in acne, a problem. Okay, acne issues. There is increase in insulin spike also, IGF, in insulin growth factors also. Because of sugar also there is increase in insulin spike. So both the dairy and sugar are something we ask patient to avoid as much as possible.
Okay.
And then talking about junk food. Okay, it's not
the
even
best
doing,
part. The best part these days is junk
yeah,
food.
yeah. It's not scientifically proven
Okay.
that it gives any problem, but it's not doing any good to you as well.
Right.
Okay. So as I told previously also, like whatever is doing good to your body, okay, whatever is healthy for your body is healthy for your skin. And it's very simple. Don't make it complicated. I can't eat this, I can't eat that. Yes, you can definitely, acne prone people definitely should avoid, dairy products. In dairy products also, like milk, cheese, you can have paneer, you can have curd, you can have ghee. That's not a problem. But that is also like people like, no, I can't have milk, so I can't have paneer. I cannot have, no, you cannot have milk particularly, and you cannot, like, because those things give more inflammation.
I can actually relate to this. So I think I was telling you earlier, right, that my family can't live without dairy. I mean, we pretty much have all kinds of dairy products that we can. But I know of people, so you give them paneer, for example, right? They get pimples the very next day. Okay. You give them milk, then there is some or other skin issue that pops up for them. But I can very much relate to it. So the main part here to understand is we need to understand how our skin is.
Yeah,
right?
we need to understand how our body is reacting. Listen to your body. There are so many diets also, keto diet, vegan diet, everything. But that doesn't mean like if keto is suiting for you, it's not going to suit for me. Okay, it's not like we both will have the same. We don't have the same genetics, right? So like a diet which is followed by Americans doesn't mean that if I follow it, it's going to give me the same results. It might, or
it may
might
make it
not.
worse.
Yeah,
actually.
it might definitely. So there was a patient, a young girl, maybe in her 20s. She came telling, I have acne, facial hair, and everything.
Okay.
She has a lot of problem acne, especially acne and hair loss as well. Okay, and she told me, I am vegan. I'm on vegan diet.
Okay.
And I asked her, like, was it fine before that? Yeah, it was fine. She's not realizing that
The
diet has caused her all of these problems. I'm not saying those are bad diets. Vegan diet do wonders for so many people. Okay.
Right.
So because it does wonders for so many people, she told me, like, I started it because my friend started it. Okay, she
Again,
saw
social pressure.
social pressure. So this is all the game of social pressure. Okay, so you just want to make it complicated. Try diets. I'm not telling don't try diet. Try keto, vegan, whatever you want to try. But also listen to your body. When you start a diet, is it making it worse for you? Okay, just listen to it, and your skin will be better.
What are some of the symptoms that one should look out for? We spoke of diets, right? So let's say I think I may have some skin issues, but what are those symptoms that the body is telling us which I should be looking out for?
Inflammation. Your gut is inflammation means like when you have inflammation in your body, your gut, you would be definitely bloated. You'll feel weird. Your skin is dry. Your skin is your breakouts has increased.
The puffy kind of
puffiness,
feeling. Okay.
Eyes, puffiness under your eyes, and all of these things. These are your skin gives a lot of symptoms. Okay.
So basically, as an aesthetic physician or as a doctor, when you look at someone, you can tell a lot about their overall lifestyle as well.
Yeah, definitely we can. Okay, and then very common PCOD. PCOS. Okay,
Yes.
when a patient comes major, like every third woman has a problem. When they come, we can tell they have. Okay, they have a lot of facial hair. a lot of acne, hair fall problem, all these. And you can tell the patient doesn't know that these are the symptoms your body is giving you, that something is wrong in your ovaries or PCOD. But that's when they need consultation. That's when the part comes of consultation, evaluation, to talk to the patient actually. Okay,
Right.
that's how we do in our clinic. We talk to the patient. Doesn't matter if it's 1 hour or 2 hours of consultation. We need to know everything about you.
Okay.
Okay, and there are so many women have come to the clinic and they don't know they have PCOD. Once they come for
What are the
consult,
sorry to interrupt you. What
Yeah.
are the factors that they should be looking out for in case if they have PCOD?
like irregular periods, it's very common. And then some people doesn't have irregular periods, but they have a lot of acne, sudden weight gain, facial hair, hair problems. Okay, so these are the factors. Then we have to tell, please go to a gynae. Consult for once. You
Right.
think, ma'am, I'm fine. Yes, you are fine. I'm not saying you're not fine. But just, there's nothing wrong in going for a consultation to a gynae, right? Just
Right.
have a checkup. Because, when it comes to facial hair, specifically, I'm just taking an example for PCOD. So when there comes facial hair, even if they go for laser hair reduction, okay, if the hormones are not balanced,
You're just treating the symptoms.
yeah, we are not treating it internally. We have to take a holistic approach. You have to treat everything. You need to not only doing laser hair reduction will definitely it will reduce the hair issues.
Okay.
But if we don't manage the hormones, again you're back to zero.
So hormones again ties back to our lifestyle.
Yes.
To
Hormones
everything
play,
that we do.
Hormone plays a major role. Genetics, hormones play a very major role in skin problems, especially skin and hair, of course. Both.
Okay. Have you had patients who've come to you and said that I am not looking good at all because of whatever reason, and they've had a breakdown or something of that sort with you?
Not breakdown, but yeah, they are just continuously talking. There is no break. They
The
are
anxiety.
just stress. So much of stress is coming out. Especially the people who are going to get married. Okay.
Right.
They have a lot of stress, what to do. And the pressure, the stress of marriage is actually, I don't understand, the stress is giving all these problems to them. A sudden rise in, because you're getting married in 2 months or 3 months, a lot of stresses, a lot of rise in cortisol level and a lot of acne breakouts. You have noticed also, if you have some major event which you have to attend, the one day before only you'll have one acne.
Yes.
Yeah.
Right.
Yeah,
I can relate to
because-
that. Yes.
Yeah,
Yes.
because of what? Because you're stressed about it. What is going to happen? What is going to happen? So all of this is related to back to hormones. Yeah.
Nice. The whatever you just said, I think I can relate to it. My wife always keeps complaining. There's a function tomorrow, and there's a new pimple, there's a new acne that's come up. Now I can actually relate to what you're saying. So you mentioned you can basically tell someone's lifestyle, their way of living, just by looking at someone's skin, right? Let me ask you this: you look at me. What do you think my lifestyle is?
Maybe more stressful and less sleep.
Yeah, almost there.
Yeah, because I can see your hairline, and also genetic factors
Right.
are involved, definitely. But if majority is genetic for hair, but other factors are also there: stress, sleep, your habits, your lifestyle. All of these are involved. So
Okay.
yeah.
So, Dr. Silviya, you mentioned about acne, right? Which is a common problem these days in both men and women. Now, we kind of understood the factors behind why acne happens. What exactly are the treatments for acne? When I say treatments, number one is lifestyle change. That's what I understand. Now, let's say I've changed my lifestyle, even then I may have acne. Are there situations like that?
Yeah, you have changed, it definitely decreases if your underlying causes. Once we need to understand the major cause and then treat it, and then you need to take use proper products. Okay, and then there are problems like acne marks, acne scars. How are you going to treat that? You need
Sorry. What's acne marks and what?
Yeah,
acne
there are
scars?
two different things. Okay, acne marks are like the spots, the dark spots which you see once the acne goes. And acne scars are the depression. The depression you see, the pits you see
More
on
of
your
the
face.
permanent
Yeah,
thing that you have
yeah,
on a skin.
Yeah, that cannot go by applying a normal cream or whatever cream, topical creams, topical medication. You need to take proper treatments in the clinic. Go to specific clinic, skin clinic, and get treatments like chemical peels, microneedling, and all these treatments you need to take if you want to get rid of those acne scars.
Okay. So I've heard a lot about chemical peels. I mean, I think earlier you mentioned about the stressful time during marriage. I was just talking to someone before this podcast, and they told me the highest number of chemical peels they do is when a person is getting married, right? A day before, 2 days before they come for marriage. I mean, 2 days before when they are getting married, they'll come and do it. Now, is it actually very safe to do chemical peeling?
Yeah, chemical peel are safe, but it should be done under the guidance of a proper skin expert or doctor. Okay, you should not be done at home. Okay, the peels we do at clinic are of different concentration.
Okay.
And the peels you get over the counter are of different concentration.
So you also get over-the-counter peels as well. Okay.
Yes, it's like very mild peel for exfoliation. It's there in the market. Okay, so many peels are there in the market, and people are using it. Of course, they're using the social media. People are promoting it and they're using it. But you need to know the proper concentration that you're supposed to use. So if you plan to use chemical peel or anything like that, go to a doctor.
Okay.
They will prescribe you if you want to do weekly exfoliation. Go to a doctor. They'll give you a proper concentration that you're supposed to use according to your skin type. Okay. Now talking about the chemical peel we do at our clinic. Okay, chemical peel. What is chemical peel? Is basically acids, different acids, which help to exfoliate the dead skin.
Remove the dead skins,
Remove the dead skin.
basically.
Exfoliate the skin and reduce the oil production.
Okay.
Reduce the oil is the main reason, right? You have acne. Okay.
Our skin naturally produces oil.
Yeah, our skin. Everybody's skin naturally produces oil. So because of the changes in the hormones, like stress hormones and all the kinds of hormones, IGF, the oil production increases. Okay, increases, and that's what causes acne. All right. So all the problem is because of this oil. So what with chemical peel, what you're doing? We're reducing the oil production. We are exfoliating the skin. Rejuvenation is happening. So that's how we treat acne marks, or all the acne scars also can be treated, but higher level, like really strong chemical peels are used to treat acne scars. So if you want to treat acne scars or acne pits, microneedling is a very good option. MNRF, microneedling with radio frequency, is a very good option.
Tell me more about this microneedling.
Microneedling, basically, we're making micro injuries on your skin. All right, micro injury with a device.
More
which
like
has,
a poke on the face.
Yeah, micro injuries on your skin, and with that we can use plasma, PRP, platelet-rich plasma, or other like mesotherapies or anything like that. Okay, or serums. Okay, so we are talking about microneedling with PRP. I'll talk about that because that is pretty famous. Okay, so what we're doing is taking blood, and then centrifuge, and then we're taking the plasma, and then we are using that to inject it.
Okay.
All right. So there is a device, Dermapen and all these devices are there. MNRF machines are there. So there are multiple needles.
Okay.
Multiple needles, small needles, and you can adjust the length of the needles according to, there is a micro needling depth chart.
So all this has to be done under the guidance of the right person.
Exactly.
Okay.
Definitely.
Okay.
So what it does is it is creating micro injuries on your face, and increasing the production of collagen. So if you want to fill those pits, those acne scars, so the collagen production has to be there. And the collagen production will only happen like if you're doing such treatments.
Collagen is basically another hormone which...
Collagen is basically a protein.
Okay.
Okay, it's a protein. Collagen and elastin proteins which are there. Okay, and it decreases with age, and it decreases because of pollution and everything. So if you see a baby skin, it's so supple and
Right.
it's very soft, and it's, of course, collagen is a lot there in there, and of course fat is also there on baby skin, but collagen plays a major role. So that collagen is something which gives structure to your face. Okay, it's basically a protein.
Okay.
So for the collagen breakdown happens because of certain factors like acne, inflammation, and all of that. Okay, so what we are doing at microneedling is making micro injuries, and we are inducing the collagen production, increasing collagen production, so giving the structure back.
Okay. So basically you are injuring, in simple words, if I put it in simple words, you're injuring that part of the skin so that the new skin is formed.
Yeah, definitely.
Understood. So One other factor that I've read which contributes to a lot of our skin issue is basically alcohol consumption and smoking. How does alcohol and smoking affect our skin?
So if you see, like if you did a heavy drinking last night, and when you wake up also, you yourself can see your skin is very dry, your lips are very dry, your puffiness and everything.
It dehydrates.
Yeah,
Anyway, alcohol dehydrates your body.
yeah, it's also an inflammatory factor also. So
Okay.
it dehydrates your skin, and smoking also does the same thing. All right, when you're smoking, there's the contraction of the blood vessels. Okay, so basically there is less supply of the blood to your skin. Okay, so that's why, like, if you see chronic smokers, their skin is a little bit grayish because there is less supply. It's not like the smoke has made it gray.
Okay.
There is less blood supply to your skin.
Understood.
So alcohol and smoking definitely damages your skin, and not even only your skin, your overall health. Okay, so that's whatever does good to your health, body, does good to your skin and health.
Basically, everything ties back to our general health. So,
general
if you take care of the basic things, a lot of these skincare issues can be avoided.
Yeah, definitely can be avoided.
Earlier, we spoke of glutathione. You brought up glutathione. And now, you go online and you search for a face cream, you'll get thousands of brands, right? And then you'll have a celebrity who's endorsing it. She or he will come and tell you how fair their skin is, how their pimples or whatever was cleared. Now, the reason I'm bringing this up is there's a lot of debate around makeup as well. Is makeup good for skin, first of all?
It's good. The problem is not makeup.
Okay.
The
What is the
problem
problem?
is definitely, like, all of them now know, like, which is good makeup and bad makeup. Okay, like girls know, like, which company, which brand is good, and of course you should use makeup which are non-comedogenic, which are like
What is that? What does it mean?
like which are not clogging your pores. Okay, everybody knows that. It's
Okay.
very common. It's out there. Everybody knows. Every woman will know, like, which brand or which makeup is not clogging, or it's non-comedogenic.
Okay.
The problem is the applicators of makeup.
Okay.
Okay,
Like the
so
brushes and
the
all
brushes,
that.
yes. Okay, so a lot of bacteria grow on that. The best way to apply your makeup, either your hands,
Okay.
okay, either or disposable makeup applicators. Okay, so maybe a cotton,
Okay.
you can use to apply makeup. So the problem is not applying makeup, like how you're applying it. Okay, so they'll tell, yeah, I wash my brush, or I wash my sponge, but even after washing, you are not knowing how much is still there inside it. They're washing with soap and everything, but still so much of bacteria, everything is already growing there. So they use the same thing, apply it.
Okay.
So makeup is, you enjoy makeup, no problem.
Okay.
But you should know how you're applying it. Your applicator, just buy disposable brushes or sponges and just use it once and throw it. Or use your hand. Use clean hands.
Okay.
Hands are the best makeup. I apply makeup with my hands. So
Okay.
that's the best. So that's all.
Okay. So you mentioned makeup is good to use, but there are also people who have some other views around it, right? So they go back to the olden days of treatment. I'll give you one example. Aloe vera, right? Aloe vera, when we say aloe vera, there's so much of information about aloe vera on the website, but do you know if that helps actually? The reason I'm asking you this question is the home remedies that people do. How does it
Yeah.
contribute to a lot of skincare issues?
Oh my God, lot of home remedies.
Yeah.
So aloe vera, yes. Some people it does. For me, personally, aloe vera, it gives me allergic reactions. Okay. So aloe vera is okay for some people. Okay. But the things which are not okay for anybody I'll talk about is lemon, apple cider vinegar.
So I should not be applying lemon to my
No,
face.
it's gonna damage your skin. Definitely gonna damage. Lemon, apple cider vinegar, baking soda, baking powder. All these things are very, very bad for. It's just damaging your skin barrier.
Even in moderation.
No, not at all. Don't rub lemons on your face.
This is something interesting.
It's
Okay.
gonna damage your barrier. That's all. Okay. And then there is honey. Honey is fine.
Okay.
Okay, honey. And then there is multani mitti, which is very famous. Okay. Multani mitti is good for people who have like very oily skin, acne prone skin, too much oil. So they can apply it, and it helps to control the oil and all that. So there are certain things which you should use and you should not. And for that, to know that, go to a doctor. Just don't see and apply whatever you're seeing. Like people, I saw a video where like they are mixing lemon, baking powder, everything and applying it. How bad is that? How it's very acidic for your skin. And you're damaging your skin barrier with
Like
that.
a permanent damage.
Yeah. And it takes a lot of time to, make it better. Okay. So it's not like everything you see in your kitchen is for your face.
Right. Okay. The other problem that a lot of us are facing, when I say a lot of us, especially males, so people that know me, people that can see me, they can see that I have a little bit of a less hair on this section, right? And this has happened in the last couple of years. You earlier mentioned about my lifestyle. You kind of nailed it when you said for the last couple of days, because of different things, I have not been able to sleep well. But hair thinning, hair loss, and alopecia are some of the things which everybody is researching and talking
Male
about.
pattern baldness.
Please tell us more about this.
So if I have to talk about your pattern, definitely you're having a male pattern baldness. There's something androgenic alopecia. Okay, it happens because
What is that? If you can just tell us.
it happens because of androgen and genetics.
Okay.
So androgen is basically a hormone in your body. Okay, and it produces the more potent form is testosterone. And then there is another DHT, testosterone converting into DHT. DHT is dihydrotestosterone.
So testosterone basically converts it into the other component.
Yeah.
Okay.
DHT. Okay, so DHT, what DHT does is it works on your hair follicle and it reduces the blood supply to your hair follicle, which causes thinning of the hair. Okay, and thinning is basically miniaturization. Your hair is becoming thinner, and it will go to a state like it will become a villous hair, which is not visible to a naked eye. That's where we see the shiny part of the scalp. Okay, so there are different, stages. Okay, and then there is hair thinning, there is hair loss, and there is hair fall. These are three different terms. We think like all these are same. Hair fall is similar to hair loss. Hair loss is same to no, it's completely different. Hair fall is something that happens normally.
To
The hair
everyone.
normal cycle, hair cycle, shedding of the hair. 3 to 4 months shedding of the hair fall. It's very normal.
Okay.
And then there is hair thinning, the miniaturization. Your hair is becoming thinner and thinner because of certain factors.
Okay.
And there is hair loss, completely that you're seeing the bald, the shiny part.
The scalp, basically.
Yeah, the scalp.
Okay. So let's break this down further. So the first part is you mentioned testosterone, especially in males, converts it into another component that you mentioned, and which basically weakens the hair follicle, and then we have the hair loss.
Yeah.
And the second part is basically genes as well.
Yeah.
Right? So how important is genetics in basically hair loss?
Yeah. So
Sorry to interrupt you. So let's say my father does not have this problem. Their family does not have the hair loss problem, but my mother or my maternal uncle has this problem.
Yeah, so it's there in your genes.
I'm at a higher risk.
Yeah, definitely. The genes are not on your side. That's all.
Hmm.
Okay. Doesn't matter your father has it or your mother. Anybody in your family, your uncle, your grandfather, anyone in your family tree has it, that's because of the gene.
So if nobody in my family has it, is there a higher chance that I may also not have it?
Yeah, definitely. Higher chances are there. I'm not telling genetics are the only factor, but it's the major factor.
Okay.
So if I say 60 to 70% genes, there are other factors also. Stress, sleep, hormones, lifestyle, all these things are involved. Okay. So a person her genes are good. Nobody in his family has problem. But he's a chronic smoker. Okay. There are so many patients come. Most of the patients come with the genetic factor only. But there are few who come like, nobody in my family has, nobody like my maternal or paternal, nobody has a hair loss problem. But he's a chronic smoker. So what smoking does is it completely damages everything in your body, from your skin to your hair. The blood vessels are contracted, and your hair is not getting proper blood supply. Okay.
Right.
So leading to hair fall, hair loss, basically.
Okay. So let's say I've lost my hair, the male pattern baldness, basically. Now, how can I regrow it? We'll get into hair transplant a little later, but without hair transplant, is there any way where I can regrow the hair? Because there's a lot of home remedies. I'll give you one is rubbing onion on your head, onion oil. Second, basically, aloe vera is also another. If you research online, it says use this within a certain time, you'll basically be able to regrow hair. And then there is this
There's oil.
oiling, yes. Oiling also increases your hair follicles. And then these days we have a lot of supplements. I get a lot of ads which says, don't use minoxidil, don't use this. But basically use our tablets within 4 months, 5 months, you'll see results, expected results.
Marketing, no. You yourself said that this is so many C, so many I see. It's all marketing strategy. Okay?
But do these remedies work?
No.
Okay.
So you mentioned onion, you mentioned aloe vera, you mentioned oiling. No, it doesn't. Okay. So you want to massage oil on your head, you want to massage onion, you can do it as much as you want. It will give you wherever you don't have hair. I'm talking about your hair right now because we took you as an example.
Right.
So wherever you don't have hair, you won't get hair. Massage as much as oil you want. Okay. So because you have lost follicles over there. Okay, hair loss, your follicle is almost dead.
Okay.
Almost dead. You can't do anything. Even there are treatments like PRP, GFC also won't help you where you have the
What's
shiny
PRP?
part.
Sorry, can you
Okay.
just...
So talking about PRP is platelet-rich plasma.
Okay.
Okay, so it has growth factors. So we take your own blood, okay, and then we centrifuge it, put it for centrifuge, and plasma comes out.
Okay.
So we are injecting plasma on your scalp.
To regrow the follicles.
No, not the follicles. To grow your hair.
Okay.
Good hair. So basically it is a retention treatment. Okay, regeneration kind of treatment. So there are two different treatments. Retention treatment and restoration treatment. Regeneration is PRP and GFC. Restoration is hair transplant.
Okay.
Okay. Restoration means wherever you don't have, the follicle is dead. There we are taking the follicle from the backside and putting it. So talking about PRP, GFC is a retention, like wherever I can save the hair, wherever you have, the thinning is happening. We can increase the volume, we can increase the thickness of the hair.
Preventive measure.
Okay. So people who are, there is a grade, there is a scale of male pattern baldness, even female pattern. There is a Norwood scale. Okay. So there are different grades, grade 7 to 8. So when a patient comes with grade 3, maybe 3 or 2 or 3, we can help them with PRP and GFCs. Okay.
What grade I am in according to you?
You are definitely in grade 4.
Okay.
Okay. So, and grade 5, like if you don't take measures to stop it. Okay. So for you here, we can't do anything other than hair transplant. We have to take hair from your donor area, which is the healthy area backside, and implant it here.
Okay.
Okay. So these are the treatments. All right. PRP, GFC is more like advanced form of PRP. GFC is growth factor concentrate.
Okay.
So we are taking your own blood, same procedure, taking your own blood, but we have growth factors outside only. We are taking a concentrated form of growth factors and putting it. All right. In our company, it is called Region Pro 9. Advanced Gro Hair has something called Region Pro 9. Okay. Definitely gives good results for people. And then PRP, GFC, these are all treatments. Mesotherapies are also there. People who have less platelet, we can't take their blood. They're scared of, giving blood. We can go for treatments called mesotherapy. It's like cocktail of proteins and growth factors and everything. You can inject.
Which is injected basically into the scalp.
That is also injected. It's just we are not taking your blood. And the good part about PRP, GFC, everything, there is no side effect because we are taking your own blood. All right. Even hair transplant also doesn't have anything because we are taking your own hair from your own scalp. All right. But it should be done under proper guidance. Everything. And it's we are talking about only PRP, GFC. Hair transplant we'll talk later. So PRP, GFC also should be done by under proper guidance and by experienced doctors.
If I oil my hair twice a day, you mentioned that it may not save my hair follicles, but if I use hair loss shampoo, will that help?
No, nothing like that helps. Even oiling your hair doesn't help. Massaging, champy that we call. No, it won't give. Wherever you've lost, you won't have hair because of that. You won't have more hair because of oiling. And also the myth that if I shampoo my hair, I'll lose hair. That is also a myth.
So we can shampoo every day?
Yeah, you can shampoo your hair every day. Like people, especially who live in humid areas and like very sweaty, like they work out every day. So shampoo is basically to clean your scalp. The way you use face wash to wash your face, same way shampoo is to clean your scalp. The whole point is your scalp should be clean. Okay, because if your scalp is clean, there is less chances of having dandruff. Dandruff is basically yeast, fungal growth on your scalp. So talking about dandruff, yes, people who have dandruff, oily scalp, they should shampoo every day. So don't think like if I'll shampoo every day, my hair is gonna go, or
That's the perception, or that's what we hear, that if you wash your hair every day, you have higher chances of hair thinning.
That's why, especially men, what they do is just they just wash their hair with normal water. They don't use any shampoo, just wetting their hair. But they're not understanding that wetting their hair is causing them to have like this, damaging their hair.
How so?
So when you like you're wetting your hair and like you came out from a workout and it's sweaty, and you just wet your hair and didn't shampoo because you shampoo only twice a week. So basically you're just setting it down. The sweat and all is still there. It's not clean.
Which creates fungus and other things.
And all the growth is like, and you should not also keep your hair wet for a long time. Even after shampooing, you should make sure you're drying your hair with a hair dryer or anything. What female does, especially like women, they tie their hair, wet hair, and it's just like they're just sitting under the fan and just waiting for it to dry on its own. And it's been 1 hour or something, the hair is still wet. They have to tied it in a towel. But make sure that after you wash your hair, you dry it as soon as possible. Okay, talking about shampoos, there is no problem in using shampoo every day. Okay, so now sulfate and sulfate-free shampoo. This is also a problem. Like people are like going behind sulfate-free shampoo. Why they are going behind, they also don't know.
So all shampoos have sulfate?
Yeah, not all. There are sulfate-free shampoos also. So people should know who should use sulfate shampoo and who should not use. Okay, so because in market sulfate-free shampoo is so famous, everybody is going beyond sulfate-free shampoo. So they're thinking, yeah, sulfate-free matlab no chemical. That's not the point here.
Okay.
People who have oily scalp and they have dandruff and they get sweaty most of the time and living in a humid area, they need sulfate shampoo. Okay, because sulfate shampoo helps to clean your scalp.
Achha.
Okay, and the people who have like very dry hair, thin hair, dry scalp, okay, they need sulfate-free shampoo. They need mild shampoo, okay, to clean their scalp.
Okay. Now, one other thing that people in my family do, I'll probably talk about my family, when they oil their hair, they oil it in the night and they keep it till morning.
Yeah, very common.
Is that a good thing or bad thing?
No, it's a very bad thing.
How so?
Because you are, when it's oily, it's very easy for dust and everything to accumulate. Even inside your house, there is dust particles and you're not able to see it, but it's there. And the whole time, first of all, your scalp already produces oil. Everywhere in your body, wherever there is hair follicle, there is sebaceous gland. Okay, sebaceous glands are
Which
glands which
produces
produce
the oil.
So your scalp is already producing the natural oil. Okay, the myth, why do they do this thing? Like, yeah, the more I keep oil on my head, my hair will grow thicker. Okay, but
that's what we're told.
That's not helping at all. It gives growth to dandruff. Okay, and especially people who have dandruff, they are also applying oil. They are not understanding that they're feeding the yeast with oil. Okay, so most of my patients are like that when they come with dandruff, very bad dandruff, like, and they come like, what do you do? Like, you apply oil? Yeah, I apply oil. Oil and like wash it in the morning. They don't realize that's what they're doing wrong. Okay, and they apply oil and go out. More pollution, everything is there. Everything is there sticking to their scalp. And they don't wash it also, thinking I can't wash it. I can't wash with shampoo every day. So only even if you want to apply oil, helps to condition, helps to nourish, definitely.
Okay.
Coconut oil, it helps to condition, nourish your hair. Okay, but if you're applying oil thinking that it's going to give me more hair, that's not going to help. You're going to be disappointed because it's not going to help. Okay, so if you want to apply oil, just keep it for like maximum 30 minutes. That also just apply on your hair shaft. just apply it and keep it. And especially female, you can just apply to make your hair.
Not to the entire scalp.
Yeah, scalp does not need it.
Okay.
Scalp does not need oil. Okay, so just apply on your hair shaft, keep it for maybe 30 minutes, and then wash it off.
Okay. And how often should one use oil or oil their hair or scalp?
Once a week is fine.
Once a week.
If you want to, if you're there are people who come to my clinic, ma'am, if I don't apply oil, I can't, just go. I cannot. I have to apply oil at least once a week. Whenever I get headache, I have to apply oil.
That's what I've heard. There are people who says I get headaches if I don't use oil or don't oil my hair.
It's just in their head. Because always whenever because our parents, because they always apply oil and did chumpy for us whenever we had headache. So it's just if I put oil, I'll be fine. Okay. So basically massaging your scalp. You just need a medium to massage your scalp.
Okay. So the key thing here is massaging your scalp. And does that help basically in your hair thinning? If you're doing having a lot of hair thinning, does massage help in any way?
No.
Not at all. Whether you use it with or without oil.
Yeah, does not. Massage like hair thinning, no.
I now want to bring up hair transplant. We earlier spoke of hair transplant, the two different kinds of treatments that we have. Many people know what hair transplant is, so we'll probably not get into what it means. But there's a pro and there's a con. So what I've heard is pro is basically you get new hair, but the con is that there is also increased chance you lose that hair if you don't take care of it. When I say don't take care of it, basically you may have to supplement it with probably minoxidil or whatever. Now, tell us more about this process, hair transplant process, if you can.
So, pros, hair transplant, as you told, people tell that they lose hair. So, that doesn't happen. Have you talked to people who have done hair transplant and they have lost hair and something like that?
No, not really. Not really.
So basically it is what's in the social media again. Okay. So hair transplant is basically by taking the donor area. Hair transplant can't be done for everybody who has hair fall. You need to, see if the patient has good to healthy donor area also. Okay. It's not like anybody is coming to my clinic, hair loss ho raha hai, I want to go for hair transplant. No, that's not how it is. We have to evaluate.
Okay.
Evaluation is very important. Consultation is very important when we are doing such treatments. Okay. It's not like every person who steps into my clinic goes for hair transplant. Okay. We need to see.
But what is the percentage of patients that usually go into hair transplants of the patients that you see?
So we can say 25 to 30%. Because majority of them also price is a major factor.
It's not a cheap thing to do.
Yeah. Even if you want to do hair transplant, they want to do. It's not like they don't want, but pricing is a major factor.
Right.
Okay? Even though we help people as much as we can, okay, but still there are people who are cannot afford that kind
You
of
charge
treatment.
for every strand of hair.
Yeah, it depends. Depends on different. It's not like every clinic or every company, every hospital or every clinic you see charges according to follicle, but it's different everywhere. Also, the fact that we have to see is who is doing it. Surgeons, you need to know who is doing it. There are clinics where technicians do it, OT technicians.
So ties back to the earlier discussion. Right guidance is needed whenever you're doing any kind of
You
treatment.
need to know who is doing it. How many years of experience they have. Okay. And you need to, because why I brought up this thing, because there are so many clinics we have seen that OT technicians are doing, even though
What's a OT technician, if you can just...
the OT, operation theatre technicians.
Oh, people who basically assist.
Assist. They are doing it. They are the people who are assisting.
They're not
surgeons,
certified to do it.
No, not at all. And you need to have an art to do hair transplant. It should look natural. Right? You need to know what all factors you have to consider when you're doing hair transplant. You need to design the whole thing. Okay, you can't just go and just take hair and put it there.
Is it a painful procedure when you do it?
No, it's not. It's not a painful. Little mild discomfort after the procedure, but no, it's not a painful procedure. It is done under local anesthesia. It's not it's not even done under general anesthesia that the patient has no idea what is going on. It is done under local anesthesia. Okay, and it's not a painful procedure. very, very mild discomfort some people will have after procedure, maybe for 1 or 2 days, very mild discomfort. Other than that, it's not at all painful.
And it's a safe procedure.
Safe procedure. If it is done under proper guidance and done by proper surgeons.
Okay.
Okay.
Now, I was talking about the cons of it, right? So I think some of the things that I've heard is that when you do this hair transplant, post that you will have to use certain treatments or certain medications to make sure that those follicles are those follicles stay there. So when we use these treatments, these supplements, I've heard that you get hair on other parts of your body, especially your face.
So talking about minoxidil basically.
Yes, actually.
So minoxidil is, we prescribe minoxidil for after hair transplant and before also. Minoxidil prescribed to so many people who lose hair, have come to the clinic with hair loss problems. So minoxidil, yes, it gives hair wherever it touches. That is true. That's why you should know how to use it. Okay. So when you're using it, you make sure like you're using a proper amount. You're not just spraying it everywhere and just massaging. You need to apply where you want hair. Okay. And first of all, you are not supposed to massage minoxidil in your scalp. Okay.
Just
so
apply it.
You drop and just spread it out wherever. And when you're sleeping, especially like when you're sleeping on a pillow mein you will get minoxidil and you're sleeping. So that's why patients, wherever it is touching, they are having hair growth over there. And then there is also, talk like minoxidil has a lot of side effects.
Right. So it affects certain organs.
So, yeah. And like they have this thing that patient who come to my clinic, ma'am, minoxidil I'll use and then like I'll have more hair fall.
Right.
Hair loss.
Right. Initially, that's what I had heard as well.
So like if I stop it and then I'll have like more hair fall. So you need to know how to use minoxidil. Okay. So minoxidil, it's basically increases the blood supply to your hair follicles. Okay.
So basically, when I apply minoxidil, my body starts sending more blood to that area.
So yeah, talking about minoxidil, so it was, given to patients. Previously, it was given to patients with blood pressure. It's an anti-blood pressure medicine.
So historically, that's why minoxidil was used.
So when they gave, doctors were giving anti-blood pressure medicine, minoxidil. So they saw a good side effect, that is hair growth. Hair is growing thicker. So what minoxidil does is it increases the blood supply, stimulates hair growth. So first 3 months are difficult for patients who are using minoxidil.
When you say difficult, in what ways?
Hair fall happens. So these are hair which are already supposed to fall. I told you about hair cycle, right?
Yes.
There is shedding phase. Okay.
Yes.
So these are hair which are already there. You are supposed to fall. So it takes 3 months for the hair to fall. These hairs are dead. Okay. These are in the shedding phase. These hair they are already dead. So what minoxidil does is it fastens the process. Okay. The blood supply increases. The new growth hair, the new hair starts growing.
Right.
And the hair growth increases, so the new hair starts pushing the old hair. So that's why the hair fall process is fasten. Like the pace is like fastly the hair, whatever has to do fall in 3 months, it starts falling.
So the initial phase when we lose hair, that's because of this process.
Yeah, this process. It's a natural process. Okay. So there is a false information that it causes hair fall. So the patients who just complete this 2 to 3 months of using minoxidil, they have a very good results.
Okay.
Yeah, they keep using it. And also patients who stop minoxidil suddenly. Okay, when you stop minoxidil suddenly, they see hair fall. So when you are giving your body nutrients and you suddenly stop it, what happens? You lose everything. The same thing with hair minoxidil also.
Okay, so the other side effects that I was telling you earlier, I've heard people say.
Yeah, so basically you were talking about headache. So one side effect of minoxidil is people usually get headache and itching because there is a gush of blood. There is like, I told you, the blood supply increases.
Right.
So sometimes people get headache.
That's a known side effect.
Yeah, there's headache or itchiness, and sometimes people get dandruff also. So what you're supposed to do, if you're applying minoxidil at night, make sure you wash it in the morning. That's why we ask people, especially the people who come with this complaint of itching and dandruff.
Okay.
So because minoxidil is good for people who are able to use it.
And
For-
does it affect any organs? That's one
No,
of the
no,
miscommunication that I've heard maybe.
it's not minoxidil, it's finasteride. So
Okay.
finasteride is basically DHT blocker. So yes, there are like cases where finasteride has caused people when they have used for a long period, it has caused some libido problems, erection problems. So yeah, so everything that you take, there are so many hair growth products. You should know, you should talk to the doctor and take it under the guidance of doctor.
Even if I'm taking any supplement which is
Yes.
certified to be herbal and says that it's a proven
Yes.
thing,
Yes.
even then I have to consult.
Yeah, it's better to consult. That's all. And so we were talking about hair transplant. So hair transplant, yes, we do give patients minoxidil because it helps. So I told you how minoxidil helps. The blood supply and stimulates hair growth.
Right.
Okay, so that's the whole point of giving minoxidil after hair transplant.
So in the very first part of our conversation, you mentioned about glutathione. Now, if I open my Insta page, for example, I get 3 or 4 ads says, "Why do you celebrities have such glowing skin? Because they use glutathione." That's the actual Insta page that I see
Yeah.
almost every day. Tell us what glutathione is. You may have touched base on it, and does it really help?
So glutathione is an antioxidant. It's a master antioxidant already present in your body.
Okay.
Okay, so it decreases because of free radicals, oxidative stress, pollution, and everything.
Okay.
Okay, so glutathione, how it came into skincare thing is, so glutathione was given to patients with liver problems. Okay,
Okay.
so
To treat what kind of disease?
alcoholic liver
Liver
disorders,
cirrhosis.
yeah, alcoholic liver or anything like that, to detoxify their body. Okay, so doctors gave to such patients, and they saw this again, this good side effect, that there was brightening effect.
Oh.
Okay.
So it was not identified initially. I mean, it was not designed for glowing skin.
Yeah, no, it was designed, it was given to patients with liver problems and all of these things. Okay, and then it came into the beauty industry. And also, people need to realize, even if they take IV glutathione, it's not a permanent solution. Okay, you take maybe, let's say, 8 sessions of it. Okay, you take it, and then after 3 or 4 months, you'll be back to what you were. Okay, if you are having also like that glowing effect, you are becoming one shade lighter also, you will be back to what you were. Okay,
Even the oral glutathione is also the same thing.
yeah, same. So there are the different modes of like types of glutathione, IV glutathione, oral glutathione, and I think there are creams also, or sprays also for glutathione and all of that. Okay, so people need to understand, like, what they're seeing in social media is not what actually is. Okay, when you come for consultation, so patients, recently only so many patients came for glutathione, and I told them also कि permanent नहीं है, it's not permanent. Then also they're fine. Okay, we want to see. So I was like, first 4 to 5 sessions are basically, it's only going to detoxify your body.
Okay.
Nothing else. If you want to detoxify body, it's very good. Please come take glutathione. If you are someone with, you consume alcohol very often and you have been smoking for a long time, it's very good. Come to the clinic, take glutathione IV, detoxify your body. That
After
way
consultation.
Yeah, after consultation. Take it. Okay. But don't come with this key, I'll have a very fair skin because of glutathione, whatever they say in the social media.
Okay.
So everything has to be realistic.
Understood. Now, I think we are almost towards the end of this conversation. I'm really enjoying the conversation because there's a lot of information which I would definitely go back and use. I've read some of your treatments that are in place, and I'm really fascinated to know more about this.
So I'll talk about the treatments that we do in our company, in our clinic. So there are treatments from chemical peels, laser hair reduction, IV glutathione also we do. And then we have oxygen laser therapy for hair. We have PRP, GFCs, we have hair transplant. So we have everything that can help you to get, better hair and better skin.
Okay.
All right. And even like people are, skeptical, like where to go for hair transplant. Okay. We have a team of surgeons who are board certified surgeons. There is no technician doing surgeons. Nobody other than the surgeons are even allowed to enter the OT room. So all these things are very good in our company, and also the products that we have We have products, One Pro hair product, One Pro skin products. These are all R&D products. So whatever we are using in our clinic are tested, researched, and everything, and then only we use it. Right? So that's what is about advanced Gro Hair and Glow Skin.
So if I need some kind of a cosmetic treatment, right? Before I consult a doctor, how do I know I'm consulting the right one?
So how to choose right? How would you know that the person you're going for consultation is right or wrong?
Yes.
First of all, everybody goes to a clinic. The first thing they see is reviews, Google reviews. The
Right.
first thing they see. Okay, so that helps so many people. And when you visit the clinic, how the doctor is doing the consultation, you can know through doctor's consulting, is the doctor is focusing on money part, or the doctor is ready to listen to you. Okay, many doctors are like, yeah, tell me what is happening. Yeah, okay, just do this.
I've experienced that.
Yeah. So, if I go to a doctor, I would want the doctor to listen to me. Okay, my complaint. What am I going through? So you'll know if the doctor is ready to listen to you or not. So as a doctor, I listen to the patient. Even if the consultation is taking like 1 hour, I don't care. I need to know their lifestyle, their genetics, their whole like history. I want to know what they're going through. That's what builds the confidence.
Correct.
Okay, and then the experience, how many years, you'll know. When you talk to the doctor only, you'll know how many years of experience doctor will have. And the setup, the hygiene, how the clinic is. Everything helps you to build a confidence on your doctor.
Right. So that's the essential part. Before we consult or before we take guidance, we always need to understand if we are talking to the right person.
Yeah.
Because there are a lot of doctors or
definitely.
a lot of centers that have the kind of treatments you spoke of. I have one final question for you, Dr. Silviya. Now, this may be a controversial one for many people, but I still want to ask this. You are a woman in this field, right? We've heard some unfortunate things that have happened with doctors in the recent past. We've heard a lot of unfortunate things about how some doctors were abused, whether it was a male or a female. Overall, in this field, have you faced any kind of a discrimination? What's basically your take on women in this field?
I can talk a lot about it.
Okay.
So I'm not gonna go into depth. Okay, I'm just gonna give a glimpse of it. How is it to be a female doctor in this medical field? So, especially in this aesthetic field. So, the moment the person enters in the office, the first thing they see is, how is the doctor looking? How does she have any problem on her face?
Right.
Is her face flawless? Is her skin flawless?
Check out, basically.
Check out. Basically, check out. They will be looking. You can see, and it is definitely challenging. It is very uncomfortable space to be in. Okay. The person is sitting, especially male patient, so right in front of you, and he's seeing you from your top to your, everything. How is your hair? How is the doctor's hair? How is a doctor's skin? So honestly, some patients have directly told me, like right now, I have acne on my face. I know why I have an acne.
Because of the stress of this podcast.
You can say that also.
Okay,
Okay. And also, see, I get acne because whenever I eat egg, would not be the same for somebody else. Okay.
Right.
But I know the reason. But the patient will come, doctor's face, you have acne. How are you going to treat me? Okay.
Right.
You don't have flawless skin. Once in a while it happens. Not only to me, the women who are working in my clinic, it happens to them. Even a receptionist, a front desk, your face is not fine. How are they going to treat?
So basically, they're creating perceptions on the basis of what they see.
Yes, yes. So the challenging part, if I have to just talk a little bit about it, the challenging part is how a doctor is looking. We really have to take care of ourselves because that's the first impression.
Especially in your field, in aesthetics.
Yes, aesthetics. Okay. And generally, if you talk about, I think it's a male-dominated world. They think a male doctor can do justice to them than a female doctor. They think male doctor, I don't know why they think male doctor studied more than a female doctor. So yeah, so these are some challenging parts. Like some of them I've already told you. Like these are the things.
Hmm.
There are many more. You can keep on talking about it, but yeah, we just have to get through every day
Go with the
like
flow
this.
and
Yeah,
basically accept whatever you see.
yeah.
Dr. Silviya, this has been an amazing conversation for me. I've read a lot about skincare, but to know it firsthand from a doctor like you, it's been an amazing experience, and I just hope that a lot of people take a lot of tips, a lot of things that you've spoken in their skincare routine, and I'm pretty sure if they need any treatment, they can reach out to you.
Thank you so much for having me. It was
Thank you.
really fun. Thank you.